Welcome to Aesthetic TV. I'm Stuart Brazell. We're coming to you from the stage of the Aesthetic Show. Men are visiting aesthetic clinics in greater numbers than ever. Recent market research published by Medical Insight revealed that through 2019, total male aesthetic procedure volume is expected to reach 13 million treatments worldwide. As examples, here are some rather famous men who obviously depend on cosmetic surgery to further their careers. What is driving this trend? To get to the bottom of what men really want in aesthetic procedures, we've gathered 3 top experts in the field, all of whom have extensive experience treating and retaining male patients in their practices. Dr. Jason Emer is a cosmetic dermatologist in Beverly Hills, California. And next to him is Dr. Angelo Cuzalina, a cosmetic surgeon based in Tulsa, Oklahoma. And finally, Dr. Anil Rajani is a cosmetic surgeon from Portland, Oregon. Welcome to Aesthetic TV.
Thank you.
Thank you.
So, Dr. Emer, what do men really want?
Well, the truth is they just want to look and feel better. And I think in the past, everyone wanted to have surgery but let nobody know they did. And now everyone wants to have natural results and let everybody know that they did. So we're seeing men coming in droves.
And also with the divorce rate higher than ever, I mean, men are back on the market later in life. I imagine that contributes.
Absolutely.
Yeah, there's a huge component of men that are in the older population that are restarting their lives or, becoming a professional and want to look good all the time. Addressing things like sweating, for example, that may have been hidden before, now is becoming more exposed. Or if they're wanting to, now where there's sort of the fitness involvement in all this fitness and CrossFit times, people want to take their shirt off and they want to look really good. So it's not just the face anymore, it's also the body. Then you have this grouping of younger patients that want preventative treatments. They want to know what can they do right now. And so there's a lot of cosmetic surgeons that are really looking for small bits of a procedure that can give enhancement and an improvement in a result without much downtime, because we have these younger patients that don't want to take a lot off and don't want people to know that they have had something done.
Yeah, and I think, men want to come to someone that know the differences aesthetically of what a male and a female looks like, and we have to approach them differently. And one interesting aspect is, what we talk about often is a slight feminization of the male. And the males growing up now often have a lot more female role models. So there's a fine line there, and I think what we see coming into our practices are men where experience is hot, but laxity's not. That's kind of the tagline we use. So they want to look like men without that tired look. They just know they look tired, they look a little older, and they see the drooping for the facial area. And of course, body sculpting is huge for women for a long time, and now it's crossing over to men.
And Dr. Rajani, you touched upon something, this feminization where men are looking for a softer look. Obviously, Jared Leto comes to mind. What can you tell me more about this feminization trend?
Yeah, I think, traditionally we've seen females come into our clinics, and a lot of men that come to me, their partner or their wife or their partner are looking great, and they kind of accelerate and look better than the men that come in. So they kind of, a light goes off. I might want to come in and get something done myself, and that opens the door. However, when we talk about the male features, I do a lot of facial volumization, and men like longer term products. So for me, it's balancing the high cheek, the mid cheek, and the front. And it's very dynamic, Stuart, because this has changed over time, even what we're doing with females. And so with the males, they're coming in, the younger generation, they know exactly what they want. They're much more social media savvy, but the older men that come in, they just tell us, look, make me look younger. And we have to take that and run with it.
Take 10 years off of me, please.
Yeah, we have to run with that in a way that looks natural. We talked about Botox prior, and that's a softer look for the male, where we don't want to remove all the lines, but we want to make them look rested.
And then on the other hand, there's some that are coming to look even more masculine. What are they doing?
Yeah, like I did a lecture yesterday on the difference between male and female aesthetics and what we can do for men. And I think that there's a trend, and you have to kind of follow it, that Men want to have a male appearance but have some feminine features, which is what we were talking about. And the reason that is studies have shown that those males are found to be more attractive than the men that even look really burly, because those men are unapproachable. They have the furrowed brows, they have the very thick beard, they have the thicker, forehead and
almost
nose.
Like a caveman more
exactly.
type
I don't
look.
want to say Neanderthal because it makes it sound bad, but it's unapproachable is a better word, And obviously people are looking for sex, offspring, relationships. They want to do well financially, so they want people that are going to be, they want to look and feel approachable. If you're a businessman and you need to be making deals, no one's going to want to make a deal with somebody that they don't feel comfortable with. So you want to be having a little bit of slight feminine features, such as, less of a thick brow, maybe a little thinner and a little arch, but not too arched like a female, but somewhere between horizontal and elevated. Or we're talking about cheekbones, for example. Maybe you don't go as lateral, so it doesn't look as lifted in a shadowed light, but it's a little bit more filled out medial or projected, so that it looks lifted. Even lips can be done in men. And that has to be done subtly. Maybe it's not the entire volume of the lip, but it's just the way that it turns. Jawline, having striking jawline makes men look much more manly, and extending the chin gives people a lot of confidence because it flows their entire face. Those sort of things are feminine touches to a masculine appearance, make people more attractive, and that's what I think people are looking for now. They're seeing what is attractive as different than it was in the past.
So it's ever changing. It's about finding that perfect balance. So we've talked about the face. Let's get more into the body. So what are people asking for right now? What do the guys want in body treatments?
Well, all men, if they really are honest, have love handles to some degree. And we all want our love handles gone. Almost all men would say they want them gone if they could get rid of them. So that's certainly one of the most popular things. Dr. Emer, of course, does a lot of sculpting of the abs, and I know he'll talk about that. But my most common one is actually men's breast. It's called gynecomastia. And it's a common problem that men are very, very embarrassed about. So you hear the word man boobs.
Boobs.
It's boobs. It's
Nobody
man
wants
boobs.
to hear that word. Nobody wants them.
And they develop it when they're in high school usually, and it most commonly doesn't go away, and they're embarrassed. They don't change in the locker room if they're in sports. I had a gentleman that's a pro basketball player that never would take his top off in the locker room, just embarrassed for his breast. And so nowadays it can be done without big incisions. It's commonly done with a combination of liposuction and an excision of that excess gland. But that's devastating to people, and they're so embarrassed about it. And the fact that they can have it easily treated, I mean, it's becoming more and more popular.
Yeah, and I think what happens as people age, obviously, they get in relationships, they work really hard, they can't follow the diet and exercise like they want, they're not their 20-year-old athlete they used to be, so they start to carry disproportionate areas of fat. Their stomach, their flanks, those are the two major areas for men. And then obviously the breast, if they have that propensity to do a gynecomastia, it starts to become what I call the sad chest. It starts to frown. The nipple goes down, the chest goes down, the skin
now.
starts to laxity. Exactly, and no woman wants that either. So, the men are coming in and looking for alternatives. There's a lot of non-invasive things that are being promoted now, so that stimulates a lot of people to think, oh, I can have a little bit of fat reduction. What we're doing now is taking it to the next level, not only removing fat with some of the non-invasive, but using surgical techniques to remove the fat and sculpt the skin to where you can see the underlying muscle again. You can get a six-pack, you can get rid of the glands in the chest, but also create contour and a line, giving them that 20-year-old appearance again. And that's become a resurgence. Some people call 4D lipo or high definition procedures. I think
it's all about high def these days.
It is, and everywhere, even high def face. As we've even said that, but you're creating contours in a cheek. That's a high def cheek. It's really defining and sculpting. It's what you look like in a light and a shadow, because you're talking about the selfie world. Who comes in and says, I look under this light and I have this shadow here. That's not how people see themselves every day, but yet they're using these selfie sticks and they're using the picture. So our level of standard has to go up so much, because they have to look good not only in the standard light, the sunlight, the light in the room, but also their selfie lights and all this other stuff. And people look different in shadows. And so what I think is happening now is this transition between a little bit of a line improvement or a little volumization to sculpting and shaping. And it's not just on the face, it's on the body too.
So talking about men, there's definitely, we're saying that now the young guys are coming in for this, the older guys are coming in for this, but let's talk more about like age-wise. What exactly are they doing for different age groups?
Yeah, so we're seeing a lot more people come in the 25 to 35 age group. And I was in Silicon Valley just recently, and we had a 31-year-old male came in. He thought he was old. Little tiny bit of gray hair, pulls up in a very nice car. He was unemployed. They're looking for younger and younger people that are social media savvy.
So even 31-year-olds want to feel like 21-year-olds.
And there's a lot of pressure on them, Stuart. I was mentioning there's a lot of pressure on the newer generation of male that wasn't there before, and that's driving them to our practice. Then we take the 45 plus market. We have to treat them differently. They're not as open to maybe doing the procedures, or they don't know what's available and what can be done. The younger patient knows exactly what they want done. They grew up with these procedures, so they don't question the safety. Very different conversations in those age groups.
They just feel comfortable. What about regionally? Do you find that in New York City we need this, in LA it's this, in the Midwest people are coming in for specific things?
I can speak to that being in LA. So my practice is in Los Angeles, and there's a significant population of younger patients, 20 to 35, that are looking to do every single procedure.
Everything?
And everything, including I have patients coming in their 30s asking if they should do a facelift as prevention. And sometimes you think this is out of control because there's non-invasive treatments we have that are supposed to be used to sort of prevent that, to hedge that time. Exactly, Botox and skin tightening procedures and some lasers, and now there's even internal radiofrequency called thermi. So there's a lot of things that are out there, but yet they're coming in for even a surgical thing, and that's a young person. To me, that's the influence of the online, the social media, things like Real Self, things like selfie pictures.
Which aren't even real, because you can Photoshop your selfies using 5 different apps.
Exactly, and a great national example of that is Kim Kardashian, who had this really dramatic photo of her butt on a cover of a magazine, but when the actual photo came out, you could see the cellulite, you could see the dimpling, you could see the sagging. It wasn't a realistic photo. And I have patients who come to me from people that are experts in, Brazilian butt lifts, who have irregularities all across their skin, fibrosis and stuff, because they were way too aggressive to get it, but no one sees that result because they're not posting it. They're posting only the best.
Only the best angles.
Only the best angles and the best light. And so I think that there is that trend of that younger group coming in wanting preventative treatments, and it's up to us as physicians to be able to say, this is what's going to be natural, this is what's going to be preventative, this is what's going to give you that enhanced look. When it comes to the body, that I understand, because that's maintenance. People are dieting and exercising all the time. They're doing these non-invasive treatments to keep up with that, or they're doing our surgical procedures to get the etching, to get the buttock, to get the muscular development. But when it comes to the aesthetic procedures and the larger surgical procedures that were meant for true anti-aging, like a facelift, that's where we really have to be educational and show what's realistic and what's not. A 30-year-old getting a facelift may not be the best thing, and there may be an exception, but it might not be the best thing. It might be better to use some of the technologies we have that are very useful, preventative, and kind of steer the person in the right direction. And so then there's that market, and then he's talking about the ages 40 and over. There's a lot more education that occurs there. They're still in that yellow pages, word of mouth mentality. Yeah. They don't know what's out there really as much anymore. One person's friend told them this. You really have to, to get that lifelong relationship with them, and it really is lifelong. They're only 45. I mean, people live to 100, 110, 120. That you need to educate, discuss, talk about short-term and long-term plan. They've never experienced that before. They don't know what's out there. So
people just want instant
gratification. So, I always tell people, are you an instant gratification person, or do you like to date and develop a long-term relationship? That's my practice. If you're instant gratification, probably shouldn't come here. But if you're dating a long-term relationship, then maybe that's your perfect person. That's kind of what I think the physicians need to do, especially with men, because men typically want a result right now.
Yes.
And they're coming in, they've never done it before, they're nervous, and they want, my wife told me to come, or my partner said come in, I want to do this, this, and this right now. but that could make them look unnatural. It might not be what they need. It might not be the best stage in the process. That's where we all come in.
Yes.
You're got a different group of patients there in
See, that's
California.
LA.
I'm in Midwest, in Oklahoma, Texas. They don't come in with the sometimes abnormal things that they want a facelift at 30. I don't see that at all. But I do have people that come in that are way overweight that really are just too heavy to get it, because the Midwest is one of the fattest areas of the country. And really Oklahoma, Texas, Mississippi has the highest weight. And so you have to turn people down sometimes that carry all their weight on the inside of their belly, on their intestines. So they've got this big, truly a 12-pack, it's a beer belly. And they really don't have any fat that you can liposuction. So I don't get the people who want the facelift at a young age, or they're unrealistic from that, but they're unrealistic on what you can do for them on their body because they're overweight. Now, having said that, they also get a lot of gastric bypass these days. So you see a lot of men after massive weight loss, and they come in massive amounts of loose skin. And so men can have tummy tucks too, just like women. And the tummy tuck on a man actually works just as well or even better than female, because they don't have some of the muscular issues females have from having children, and they get great results from tummy tucks, the ones that come in and have loose skin. So even procedures like a tummy tuck, traditionally thought of it for women, you can have it as a man and get a wonderful result.
And the thing about that too, if you pair with, he does a lot of lasers. By us, a lot of plastic surgeons do more cutting. If you pair with someone like a dermatologist who does a lot of laser, the scar that men worry about, because they do worry about having a big scar, can be treated with lasers now. So most of the time I tell them this, don't even worry about the scar, look at the end result. If you want a flat stomach and you want to have some contour finally after you've lost all this weight, it's not a bad idea to have skin removed,
And what about in the Pacific Northwest?
Well, I'm right in the middle, so I feel like I'm in the sweet spot in many ways. But we get a lot of people moving up from LA, and we have the gamut of people, and we do a lot more minimally invasive procedures up there. It's interesting because with those patients that do want a more extreme, instant result that Dr. Emer's talking about, I think we have to do a lot of educating. Those take a lot of time because we're trying to manage expectations there. And with men, they do want that instant result, and having that long-term relationship with them really can grow your practice. And that's what we've seen. They're much more patient, much more willing to wait, and they want a natural result. I think that's the most common thing that I hear. And I like that for my practice because it is a long-term relationship with the patients. And all of us here would agree, those are the kind of relationships that build our practice, make us happy, and create a great life for us. Yeah,
it's nice if somebody comes in and they're interested in everything. They trust you much more if you start with one thing and get an excellent result and then go on to the next. If you do a lot of things subpar, or just a little bit, people don't trust you as much. They trust somebody more to say, don't do this, don't do that, focus here. And I think that's what's very important with men, because they come in, they think they know, but obviously we're talking about, going from masculine to feminine appearance. It might be too much. They might not understand what, like someone came to me the other day and said, I want cheeks. And it wasn't really cheeks that they needed. It was mid-face volume loss that was coming down. They needed this to be lifted in their under eye. Had nothing to do with the lateral part of their face. Right? They don't know. Or lips, for example, men almost never bring up. But how many men do you know as they age, they have no lip?
They have no,
Everyone loses lip volume, but men are very embarrassed to come in and talk about lips because it's not in the media. So there's a great example of where we have to direct our patients to what we think it looks good. So it's always that negotiation.
Always.
And wanting to do what we know looks good and taking their concept and kind of coming up with a plan that works.
Bringing it together.
Yes.
And bringing it back to this feminization, how do your gay male patients differ from your heterosexual ones as far as what they're asking for?
Well, the heterosexual male, for the most part, usually wants a little more chiseled look. Now, that doesn't mean that a gay man doesn't still want a chiseled look. I mean, it's hard to beat a nice angled jawline.
Women like a good jawline.
Absolutely. So really, from that standpoint, it can be the same. There is a different group, though, also of men who have had sex changes or that are transsexual. Now, they really will want the feminization, and that's a totally different subset. They'll want the arched outer eyebrow. If you arch an outer eyebrow it's going to feminize you. You know, a high cheekbone is going to feminize you. A little bit more of a slope on the nose is going to feminize you. But those are a specific group of men, and in general, most men don't want that unless they're transsexual.
In my practice, we call it traditional and non-traditional male. I don't even call it gay, because I have a significant amount of male patients. And so my traditional is sort of, you know, the typical man that's married, that has a job, that has gained some weight because he doesn't have the time, and, you know, has kids and those sort of things. My non-traditional could be even the single guy, you know, that's going out. The interesting thing between the two is what is their end goal? Because some of the guys that I have coming in who are gay are looking for relationships, they're looking for fun, they want to look as best as they can at their age. And so that may mean, well, I want to have more of a chiseled look because I'll get attention. Or I want to have a bigger lip because people notice me more. Whereas like the non-traditional, let's say, that's just trying to make deals at work or look better for his wife, he might just want to look less tired. You know, he might want to have softer skin. So I kind of feel like you have to kind of understand the standards of both, and then our expertise kind of guides what each person's individual goals are, you know? And so I almost don't separate it that way, but I kind of categorize people in traditional or non-traditional, because you go towards where you're talking about feminization treatments, that's non-traditional. Normally we wouldn't go and say, let's take a man and make him look like a female. But if that's the case, then you're not going to create a square jawline, you're going to make one that's more round. You're not going to create a mid-face cheek, you're going to make it lateral. You know, you're going to fill out the temple more and lift the brow, because those are more feminine features. Whereas with men, we want it to be a little bit more bossing on the forehead. You want the nose to be a little thicker. You want the lips to be a little bit, you know, less full if it's very masculine, you know, appearance. So you kind of have to assess it, but it's good to understand, you know, where everyone's coming from.
Where everyone's kind of falling.
Yeah, and there's not one standard. I think you see partners come in and one's getting treatments and happy to do so, and the other one you'd love to treat, but they don't want any treatments.
All the time.
Right?
All the time.
And so there's not one standard. I think the way you put it is great, traditional, non-traditional. So it's interesting between partners even, there's
what people want.
Definitely dichotomy.
So how do you market to men?
I use a lot of social media. I kind of, you know, I'm a gay male, take care of myself, have a significant male population. So I kind of show things that I do that I think men would want, how it relates to my office, but how it also relates to my life. Now, some people who are physicians don't want to open that door. To me, I'm in Los Angeles, I'm in a competitive market, I want people to know I do high-def sculpting. I go to CrossFit, I exercise, so often I'll have my shirt off in the social media and people will say, oh my God, I want the surgeon that also has the six-pack. You know,
it's like, not only do I want to look good, but I need my surgeon to look good too.
Yeah, I know, but listen, I mean, would you go to a dentist that has bad teeth?
Absolutely not.
Would you go to a hairstylist that has bald patches? I don't think you would. So that's the thing is, you know, there's always this balance between how you represent yourself and your education and your experience. That's where, you know, it is. And I try and fall somewhere in the middle. I mean, you have very good looking guys here too that have completely different practices and have a lot of male patients.
I have a good looking panel, guys.
You
well
know,
done.
It's a great looking panel. I honestly, I can't even believe this guy's skin over here. It's amazing. So, but what I mean by that is that, you know, I try and represent myself for the people that I want to bring in. I'm sure they do that same. And I think that's the best way to do it, because when people see how you take care of yourself and how you treat others, they'll trust you to do the treatments that you want to do. And so I think the marketing can really be your own patients and the word of mouth, but social media is really a bigger thing.
Social media is a big part. What about for you?
Well, if you consider men make up about 10% of the practice, so you've got 90% of women who come in often with their husbands or significant friend. And so, boy, that's some internal marketing that's hard to beat. They see that their wife is getting this done. And if they see things in your office that are offered toward men, or if I talk openly that I get Botox or whatever I do, then it makes them more comfortable to say, well, maybe I would do some of this. And that, and maybe their significant others looking better too, so all of a sudden they want it as well. So a lot of internal marketing is the easiest way. But of course, the internet now, the men are going to look. If they have, like I said, man boobs, gynecomastia, they're going to type in gynecomastia.
They're doing research.
They're going to do their own research. And a lot of times I don't even have to explain that much when they come in. They've already researched the heck out of it. I've got to tell them what's realistic and what's not realistic.
Right.
I've done this for a long time, and so I think our practices build around the character of the doctor. And so as a straight male, I have a lot of straight male patients. And for me, I play a lot of sports, so I meet a lot of people. And I found the transition interesting because in the beginning, 10, 15 years ago when I started, no male would talk to me in a locker room about their problems. They would take me aside maybe 5 years ago. And now we're in a locker room, we're showering, and I'm assessing people. Uncomfortably so, and in front of people.
Can we not do this in the shower?
You know, so my patients come from their husbands because they're the husbands of the wives want to know, okay, I'm going to go see Rajani. My wife looks good. He's a guy. He knows what a guy's. So I think for men, we tend to attract male patients somewhat. And so through our activities, we can pick up a lot of patients. And word of mouth still is the best, single best way to build your practice. And it's what builds a practice that I'm comfortable with that brings in great patients. So social media is absolutely amazing. Being a little older than Dr. Emer, I embrace the social media, but mine's still a word of mouth practice.
But I want to say something to that because he's talking about good patients versus bad patients. And or unwanted patients, I don't know what you want to say, but the word of mouth patients are typically the best because those are the loyal patients that have been coming to you. They understand your style and personality. They know, what their friend has gotten, so they have some education. People that are looking online are typically unsatisfied for many reasons and are unsatisfied by other practitioners. Someone comes in, they've had 6 doctors in the past 2 months. That might not be the person you want to treat.
Kind of a red flag.
Yeah, exactly. And so you're going to have a significant number of people that are trying to find you on there, and that's great if you're looking to build, but not all those patients are going to be the ones that you want. Again, it's a long-term type of relationship. I'm not going to go date every person. I have to pick the right people. So you have to be much more aware in those situations as to who is the best. And it's not women, it's men too. It's every person. Not everybody has the best relationship. And sometimes you have to say no, in those cases.
We become very good psychologists.
Yeah, or hire one
There's a high incidence of body dysmorphic disorder. And we talk about Pacific Northwest. It's a little bit less there, especially in the male population. And I'm sure you see a lot more of that maybe in the male patients than we would.
Yeah, and it's funny, what I do with the high def sculpting, a millimeter or 2 off, and it looks completely different for the rest of their life. So it's, there's a lot of, I'm not saying I need to have this much pressure, but there is that much pressure. But then being in LA, people paying a little bit more money, coming from afar to have the treatment done because not many people do it, there's a high level of expectation. And that then transcends over to the customer service in the office, the touch points that people experience, their relationship with you. So there's a lot of things that go into it. But the same thing goes for fillers and things, somebody...
And
it's always about
managing
managing expectation,
I think
isn't
that's
it?
I mean, the dating concept is great because I like to see my patients back.
Me too.
And I like to follow them up. We all do. And that's something that the public, I think, doesn't realize, that we want great outcomes. It's so many moving parts to what we do, and we're trying to hit the bullseye, and it's very difficult. But we get a lot of patients that want to fly in, and we kind of don't like to see a lot of patients from different areas because it's hard to follow them up. And if they fly in, then they've got to fly back.
And you never know if you'll see them again.
Yeah, so social media tends to bring some of those types of patients in too. So that it becomes a bit difficult.
So I want to talk about one more thing, and we kind of touched on this, but this new trend, that the CEO facelift for the guy that's, the high-powered executive, or they're trying to stay on top. Are you finding that this is a trend?
Absolutely, and really, they're a better group of patients. I mean, give me a 50 or 60-year-old man versus a younger man. More likely, they're going to be more realistic. The younger new generation of men tend to be a little more picky and to be a little more unrealistic on what can be achieved compared to the CEO who's just looking to truly look better, younger, stay in the workforce. There's an acronym called SIMON, and it stands for SIMON. It stands for Single Immature Male Obsessive Narcissist. And that's who you look out for.
I know a lot of those.
As you look out for the SIMON. Yeah, that's Jason's practice. Yeah, it's LA. But in Oklahoma, especially, I'm very fortunate in that a lot of them are the 50 and 60-year-old CEO types that are coming in, and often they may need a facelift, but they're realistic on what to achieve. They're not looking to look abnormal. They just want to look youthful again and keep them in the workforce
They
for a
want to
little
keep
longer.
that CEO position.
Absolutely.
And
absolutely.
talking about business, you talk about CEOs. What we probably more commonly see, what I definitely more commonly see, is the people and the patients that cannot retire. They go to their retirement planner at 1 to 2% interest a year that they can get. They go, you get back to work.
Right.
So there's a lot of competition in the workplace. So the CEO facelift is very interesting, but really what's driving our practice are those in the workforce, and you need to look good. It's a youthful society. And so you need to look good to work, and people are working, and they feel better longer, and we're part of that.
Confidence is everything.
I mean, there's younger people that are now have many degrees, and so even the person that's been in a practice for 15, 20 years could be bumped out by somebody that has 2 MBAs.
At 30.
Exactly, and they could be, that person now can be their boss. So there are people that are, that are in that level that want to look and feel good and still have that high level executive at work, but also at home, and feel that way. One of the things I think that's really expanding this is that it's not just the surgical cutting part. That's very technical, requires a lot of skill for a man, specifically for a man, because they have hairline. There's a lot of other things that are involved. If you're bald, to actually do it without seeing a scar, much more difficult. But in that case, what I'm doing is I have a lot of I don't do surgery, but I have surgeons that do surgery with me. I'll do fat transfer to the face and laser resurfacing, and we'll do eyelid skin surgery and fillers and things like that at the same time, so that one downtime they get a much better outcome. And even though it sounds like it's a lot of things, it can be done in little bits to give an enhancement on the facelift appearance, so the result's not just a pulled look, it's a contoured look with lift at the same time. That's where I think the trend is going. That's why more, I think, older patients are coming in, and yeah, their expectations are better, but they still are looking at these awesome results that are happening now with combination therapy, and they're wanting it.
So patients, do you feel that usually they are leaving pleased? Do you feel like it's still kind of 50-50 with expectation?
We wouldn't be in business if it was 50-50, so they have to be pleased, and thank goodness the majority are extremely pleased. Most of that comes in the consultation in deciding really what they need that's going to make them look better. You don't want to do something that's not going to help them, but making sure they understand realistically what's going to take place. If you haven't done a good job explaining what you can realistically achieve, then they might not be happy. If you've told them and you do better than what you've told them you were going to do, that's great. If you do worse, then they might not be so happy. So luckily, if you do a good job with telling them what can realistically be achieved, then they leave very, very happy.
They're happy, they keep coming back.
Exactly.
In a moment, we will show examples of successful anti-aging aesthetic treatments on men. But before that, I wanted to cover any remaining trends in male aesthetics. So let's talk about future direction and new trends. What are we going to be talking about this time next year?
I think it's penile rejuvenation. There's a lot of talk right now, and there's a lot of treatments on women having genital treatments. Men want hair. They all want to have hair. That's one of the things. And then the other is they want to have the best sex life possible. That's
Who doesn't?
So, it used to be vitamins and supplements. Then it was some surgical procedures. Obviously, we're doing non-surgical on the face and body. Why couldn't we do non-surgical there? And that's where I think the trend is going to go. Obviously, there's other things like body treatments and other devices that are coming out that are targeted towards specific things that men want. But to me, I think it's going to be the hair and it's going to be the genitals.
Yeah. I hope the devices keep improving. I think if we eventually get to that point where we have some devices that really work fantastic, that's what you'll hear about. Right now, there's great devices, but none of them really to that point that we want them to be. Nothing can compare to surgery. So if we can get those devices to get even close to the surgical result, then
so technology.
Absolutely. When technology catch up, it will be wonderful.
Because if the technology advances to either be preventative or post-surgical, keep the result forever, then you're talking about big deal. Because how long does a facelift typically last? I mean,
right,
in
5
general.
to 10 years.
Right. So then how often does someone really want to go through that a couple times? Not really. So if you can get devices that can be in combination that really work, I mean, then you're talking about doing a very extensive amount of patients, treatments and maintenance long term.
I think combination treatments is ultimately where it is. We always talk about the time machine. right? We all want the time machine. And I think the day is certainly coming where you not literally walk into the machine and walk out younger, but the devices are getting better to where there's less pain, less downtime, and great results, but they're not quite there. So for my practice, I've been using combination treatments. So example, we use fillers and neuromodulators such as Botox, platelet-rich plasma, microneedling, all in the same visit. We're now using PDO, which are dissolvable threads. And I think we definitely need more studies on combining these products. However, we're doing it now, and we're able to do more in one sitting, get better results, and I think you're going to see that progress.
Well, times are exciting, and now it's time to have a little fun. Let's turn to examples of the ideal makeover for men. It's kind of a show and tell. I'll show you photos of celebrity males that got some work done, and you guess what treatments they might have received.
Ooh, I love doing this.
It's our very own game show.
Oh.
Kenny Rogers.
Yeah. It's obvious on him. His brow lift was overdone. He's had, a little too much fill in his cheeks. But the brow lift, if you lift a brow in the middle of your eyebrow, it's going to make anybody look weird. And so it makes you look surprised when you lift the middle of the brow. And on men, you don't need a high brow. Normally the male brow should be right along the orbital rim, the bone. And you can see with Kenny, the middle of his brow by his nose is elevated significantly. So he looks surprised, in addition to the other issues in his cheeks.
He's surprised he looks like that.
Yeah, I know. That's exactly right.
We actually don't know.
Yes, I know.
All right, who's next? Dwayne "The Rock" Johnson.
Let's see. Well, he definitely had gynecomastia surgery on his chest. For a long time, he's been doing some supplements for muscle growth, and you can tell there that he had some puffiness that's now improved. Now he shaves his head, which is a trend. And so the question is, are we going towards shaved head, or are we going towards people trying to keep their hair? Like this guy over here has got the best head of hair I've seen these two.
So it's almost a good idea if you feel like you can go with the shaved head. If you're losing your hair, just start it. That's your look done.
Yeah, that's me. That's what I'm doing. Just get a little bit of a buzz, but still, I think it looks good and it's easy.
He just looks good in general, I
Yeah,
think.
he's a good-looking guy.
All right, Zac Efron, another one of my faves.
So he's got a personal trainer, okay? That's the thing. He can afford to have a trainer 2 or 3 times a day. But he went from, a scrawny sort of athletic look to someone super muscular and chiseled. Some, I'm sure, is just adolescence and having good testosterone levels. But if you work out with a trainer every day, 2-3 times a day, you can have that type of six-pack.
I also have to point out that both of these guys, The Rock and Zac, are currently filming Baywatch. So I feel like they're in a
There you
good
go.
place.
Yeah, of course.
But do you feel like he's had anything done, or do you think he just takes care of himself?
No, I personally think he's probably just taking care of himself. I wouldn't be surprised though if some of the younger guys are getting some light laser treatments, a little bit of fillers and Botox probably, but very subtle. It's hard to
With
tell.
actors, you have to have your expression.
Right.
If you
Right.
can't,
Hard to tell.
it's very noticeable.
Very natural look. I mean, looks great and normal.
Yeah, he does.
Looks normal.
He looks perfect.
He actually had
Yeah.
high def done by me. No, I'm kidding.
No.
Don't publish that.
I wish it.
But yeah, that's
we're-
what I hope my patients look like.
We're dynamic, so it's important when we're looking to determine what people have had done facially to watch them express themselves. And that often gives the key to either an overdone look or an unnatural look. And some people want to look a certain way at rest, and that's because of the type of work they do. That's most important, for instance, models. Whereas someone like yourself, you're talking all the time. The dynamic motion is very important.
Oh yeah, if I had a frozen face,
Right.
it would be obvious.
And lighting.
And the muscles, if you'll notice, the muscles in his abs, they're not lined up exactly perfect.
Right.
And if he had etching where someone that really didn't know what they were doing, like,
It'd be straight.
it would be a straight line. There's no such thing as a straight line on the human body. There's always some degree of curves.
I'm going to be looking for that at the pool.
Absolutely, and the abs don't necessarily line up the six packs, and that's a natural. If I want
Very
to do the
interesting.
sculpting of the abs, like Jason does a lot, I'm going to model after him because his is a very natural look. I don't want to put a harsh straight line. I want to make it look like it's true abs.
I always tell people, if you want to look like a Teenage Mutant Ninja Turtle, then you go to somebody that doesn't know how to do the 4D vaser. If you don't, you have to follow your natural curvature. And I tell my patients, do as many abs as you can until you have surgery. I need to feel what your normal anatomy is. You look at his, he's got defined lines, but it's not perfectly even. That's his natural way.
It's totally natural.
You would contour that to make it look natural if you were going to do that. But obviously it's not, because that's his own body shape. The one thing I will point out, and I do think this is important because I see a lot of younger guys, if you look at his face when he smiles, you see how he has that double kind of wrinkle on the side? That's usually a sign that the underlying anatomy, the skeletal structure, doesn't support the face properly. So he will, unfortunately, age much more quickly than other people if he exercises a lot.
Is he going to get like the sagging?
Yes, and the center part and the folds will come down. He's going to need to have fillers or an implant at some point. And so I would say, even though he's young and good looking, he should start going in to see people.
And that is the shame about getting a six-pack. If you have a six-pack yourself, chances are your face will look older. Because when you lose enough weight to look ripped, your face tends to thin out. And
well, there's that saying. It's like, do you want to have a hot body or a young face?
That's exactly
You
right.
Why
can
not
have
have
both
both?
now. You can have both.
With
That's what
fillers,
we're
you
talking
can get
about.
it both.
High def and fillers,
That's
you're
right.
Do we have any more men? Or is Zach our final? We'll end on a high note then. Well, I want to thank our guests for helping us understand what is driving the trends in male aesthetics. You guys are fabulous.
Thank you,
Thanks,
Stuart.
Stuart.
For Aesthetic TV, I'm Stuart Brazell. Stay tuned and stay handsome.